Severe pain and involuntary contractions of the muscles around the vagina with attempted penetration into the vagina is called vaginismus. This may be penile penetration or penetration or during your insertion of vaginal cups or tampons. These women will not allow any kind of penetration into the vagina. In this video, myself, Dr. Sneha, consultant gynecologist, will discuss about one of the important emerging treatment modalities for vaginismus, which is Botox injection into the vaginal muscles. So, vaginismus is quite a common condition and often ignored as being a psychological condition. However, it may be physical or psychological factors contribute to it. One of the common treatments which are being used is botulinum toxin A. This is a muscle relaxant. So when we inject this into the pelvic floor muscles and the muscles around the vagina, there is relaxation of these muscles. These muscles are normally under spasm and contraction for a woman with vaginismus. Imagine these are the muscles around the vagina. And if there is severe contraction, any kind of penetration is not possible. However, if these muscles relax, these women can have normal vaginal penetration. So we need to follow a multi-pronged approach. One is psychological counseling, explaining the woman about the condition, injecting Botox, also along with this doing pelvic floor therapy and giving them vaginal dilators. So how do we decide who needs it? First of all, we counsel the woman, we take a detailed history, find out what is the problem, what is causing this, and then we decide whether the woman needs vaginismus Botox treatment or not. And next level, it is usually done under anesthesia. Since it's an injection, it is normally painful and anesthesia will help the woman tolerate the procedure. It can be done under general anesthesia or local anesthesia. Local anesthesia is given around the vaginal orifice and then we slowly inject botulinum toxin into the muscles, feeling whichever muscle is spasmodic or it is tight. So once we inject this, there is relaxation of the muscle and penetration becomes possible. This is normally an outpatient procedure, usually does not require admissions and can be, if done under local anesthesia, can be done in an outpatient setting. And this takes about 15 to 30 minutes. And post-procedure, some of them may experience certain side effects like bruising at the site or certain burning sensation at the site. Very rarely women may have some nausea or systemic symptoms such as headache and all these. All these are temporary, short-lived and they resolve on their own. Next, what is the recovery of these women? It takes about 2 to 3 weeks to get back to normal, as in some of them may get back to normal in 2 to 3 hours also. But getting a normal vaginal penetration may take some time and the injection to act completely may take about 2 to 3 weeks. In this meanwhile, it is better to do pelvic floor exercises which your doctor will explain and then attempt vaginal penetration with the vaginal dilators. And then you move on to penile penetration. Many women have benefited with the use of vaginal Botox injections. And since it's an outpatient procedure, there is hardly any downtime and people can also get back to work after the procedure. The benefits of Botox injection is that it relaxes the muscle and can make vaginal penetration pleasurable and more importantly, first of all, possible for a woman who's not been able to have vaginal penetration without pain. And as a benefit, the woman can also enjoy in the due course. So one of the important things while doing a vaginal Botox injection is somebody should be prepared and motivated and be ready to insert the vaginal dilators, help themselves, and partner support is important, psychological counseling is important. All these factors put together will definitely benefit a woman with vaginismus.